Hello guys, I'm Deepak Shukla. Welcome to our channel Study Mania. Today let's learn about laryngeal paralysis. Before going there, let's see about the nerve supply of larynx. So from base of skull we have vagus nerve coming, okay? 10th nerve coming. It divides into superior laryngeal nerve and goes down, winds around subclavian in the right side to give right recurrent laryngeal nerve. Same way, from the left side, vagus nerve is coming. It divides into superior laryngeal nerve and goes down, and now here it goes down the clavicle and winds around the arch of aorta to give left recurrent laryngeal nerve. Okay, this superior laryngeal nerve is divided into two parts: internal laryngeal nerve and external laryngeal nerve. External laryngeal nerve supplies only one muscle, that is cricothyroid muscle. Okay, whereas this internal laryngeal nerve, this is the sensory supply of the parts above the vocal cord. So this is about the nerve supply. We'll summarize it again. So we have vagus nerve, okay, that is 10th nerve, that gives branches as superior laryngeal nerve and recurrent laryngeal nerve. In right side it winds around subclavian and in left side it winds around arch of aorta. That has to be kept in mind. Okay, so vagus giving superior laryngeal nerve and recurrent laryngeal nerve. Again, the superior laryngeal nerve divides into internal laryngeal nerve and external laryngeal nerve. Now this internal laryngeal nerve is sensory. Okay, this gives sensory to the parts above the vocal cords. Okay, and for the parts below the vocal cords, the sensory supply is by recurrent laryngeal nerves. Okay, so suppose this is the vocal cords. Okay, so the parts sensory supply above the vocal cord is by internal laryngeal nerve, which is the branch of superior laryngeal nerve. Okay, and the parts below is by the recurrent laryngeal nerve of the corresponding side. Okay, coming to the motor part, this superior laryngeal nerve will give a branch external laryngeal nerve, which supplies only one muscle, that is cricothyroid muscle. Okay, whereas this recurrent laryngeal nerve gives the motor supply to all the muscles except cricothyroid. Okay, so cricothyroid is supplied by external laryngeal nerve. Now it's very simple if you know that what is the action of cricothyroid muscle. Okay, so cricothyroid is the only tensor. Okay, cricothyroid is the only tensor and it is a secondary adductor, means it keeps it in the midline, vocal cords in the midline. So if you remember this thing, it is very easy. Okay, now superior laryngeal nerve, which gives branch as external laryngeal nerve, which supplies cricothyroid artery. Okay, so if there is superior laryngeal nerve palsy, the only function that is impaired is tensor function, means only muscle which is impaired is cricothyroid. Okay, whereas in recurrent laryngeal nerve palsy, the only function that impairs is abduction. Okay, actually recurrent laryngeal nerve supplies so many muscles, but the main function is abduction is hampered. So if you keep this in mind, it will be easy. Now if I ask you, if there is superior laryngeal nerve palsy, what thing is like hampered? So you have to tell that tensor and adduction is hampered. Okay, so the vocal cord will not come in midline and tensor is last. Okay, so it will become little flaccid. Now if I say if there is recurrent laryngeal nerve palsy, means what? There is problem in abduction, so this cannot go into the opposite sides. Okay, so this is the main thing that you have to keep in mind. Now coming to vocal cord paralysis proper, first we'll see the causes. The causes is surgical trauma. In surgical trauma, the most common is superior laryngeal nerve palsy. Very important. Superior laryngeal nerve palsy is more common than recurrent laryngeal nerve palsy in surgical trauma. Second cause is idiopathic. Third cause is if any malignancy is there. Fourth is post-viral or bacterial infections. And fifth one is non-surgical trauma. Here only let's see a syndrome known as Ortner syndrome. Ortner syndrome, also known as cardiovocal syndrome. Here what happens, there is left atrial hypertrophy. Okay, when left atria is hypertrophied, so there is compression of left recurrent laryngeal nerve. Why? Because left recurrent laryngeal nerve was passing through the arch of aorta. Here if there is left atrial hypertrophy, then the compression of left recurrent laryngeal will happen and there will be voice change. So this was about Ortner syndrome. Now if you see neck in proper, So there is chances of left recurrent laryngeal nerve to have palsy because greater risk, because it has a longer course. It has to come through the clavicle and then wind around the arch of aorta. So it has a greater, like longer course. So it has greater risk of palsy. But in thyroid surgery, right recurrent laryngeal nerve is more risky. Why? Because it intermingle with the inferior thyroid artery during the surgery. So there is more chances of right recurrent laryngeal nerve palsy in thyroid surgery. Again, if you see any mediastinum pathology, again you will find that left recurrent laryngeal nerve palsy is more common. Example, in bronchogenic carcinoma, viral neuritis. Why left recurrent laryngeal nerve? Because in mediastinum, this left recurrent laryngeal nerve it wind around the arch of aorta. So if there is mediastinal problem, so the nerve that is affected is left recurrent laryngeal nerve. So this was about the causes. Okay. So overall, the superior laryngeal nerve is the most common. In neck surgeries, thyroid surgeries, right recurrent laryngeal nerve because it is intermingled with the inferior thyroid vein, artery. And if there is mediastinal cause, again there is left recurrent laryngeal nerve is more common. So this was the cause of the laryngeal palsy. Now we'll see the normal positions of the vocal cord. Okay. So suppose this is a vocal cord. Okay. So which is the normal position? So normally it is there in the intermediate position. Okay. What is intermediate position? It is also known as cadaveric position. So if I draw a vocal cord here, okay, and this is the midline, if I suppose, so if it is still here, it is the median, paramedian, and this is the intermediate or cadaveric position. Okay. So if it is 3.5 mm away, so it is in the intermediate position. Okay. And if it comes this side, this is median and paramedian position. Okay. If it goes 7 mm beyond the midline, it is called gentle abduction. And if it goes more than 9.5 or 9 mm, it is called full abduction. Okay. So this is the normal positions of the vocal cord. So 3.5 mm is cadaveric position or neutral position. Now you will see where you see all these positions in physiology or pathology. Okay. So if vocal cord is in median position, if the vocal cord is in median position, it means what? It means the cord is in the midline. So when it will happen? While phonation, मतलब जब आप बोलेंगे, so the vocal cord will come in midline. Okay. Or adduction will happen while you are trying to speak, and abduction will happen when you try to respirate. Okay. So this is very important. So median position when you try to phonate, जब आप बोलने का कोशिश करेंगे. Okay. When there is abductor palsy कब होगा? When there is recurrent laryngeal nerve palsy, so they are unable to abduct. So in that case also the position will be in the midline. Intermediate position कब होगा? This is 3.5 mm. Okay. जिसको न्यूट्रल पोजिशन बोलते हैं या फिर कैडावरिक पोजिशन. When there is combined paralysis means superior recurrent laryngeal palsy is also there and recurrent laryngeal nerve palsy is also there. So adduction and abduction both are hampered. Okay. So that will be in the intermediate position, और normally भी ये यहीं पे होता है. Okay. Coming to gentle abduction means in quiet respiration. So we'll see gentle abduction means थोड़े ही दूर जाएंगे वो, only 7 mm. If you want to have deep inspiration, the abduction will be full. Okay. Means more than 9.5 to 9 mm. So in deep inspiration, you'll find it in the full abduction position, or in the paralysis of adductors. Means adductor नहीं काम कर रहे हैं. Okay. Adductors are not working, so it will not come to the midline and goes away. Okay. So these are the conditions according to the position of the cords. So simple thing is, if you want to phonate, it should come in the midline, and if you want to respire, it should go away. Okay. To create some space. And one more thing you should keep in mind is that superior laryngeal nerve that supplies the cricothyroid muscle, and that is the adductor and tensor. Okay, so if there is any problem in superior laryngeal nerve that supplies that gives branch external laryngeal nerve, so there is problem in external cricothyroid muscle, and the problem is in adduction and tensor. And if there is any problem in recurrent laryngeal nerve that supplies all the abductors, okay, so there is problem in abduction of vocal cord. Okay, so you have to keep this in mind. So during phonation, tension in vocal cords and their approximation is required. That is done by cricothyroid. Cricothyroid is primary tensor and secondary adductor. Okay, so this will keep the vocal cords in midline position. Okay, during respiration, recurrent laryngeal nerve is involved. Okay, so what will happen during respiration? We need abduction so that there is more space for the air entry. Okay, so posterior cricoarytenoid is involved mainly. Okay, so if there is a recurrent laryngeal nerve palsy, there is problem in respiration. Okay, if there is a superior laryngeal nerve palsy, there is problem in phonation. In intermediate position, both the abductors and adductors, they pull with equal and opposite force. Okay, so they will be in intermediate position or cadaveric position. So now let's start. In recurrent laryngeal nerve palsy, okay, there is palsy in recurrent laryngeal nerve, so abductors are not working. So what will happen? There will be adducted vocal cord. Okay, so intact adduction, keep it in the midline. So in recurrent laryngeal nerve palsy, abductor is not working, only adductor is working, so it will in the midline. In superior laryngeal nerve palsy, cricothyroid is not working. Okay, in superior laryngeal nerve palsy, cricothyroid is not working, means adduction cannot happen, and there will be no tensor also. Okay, so in superior laryngeal nerve palsy, the vocal cord will be floppy and abducted. Okay, so you have to keep in mind that what is the function of each nerve, and if that nerve is in palsy, that thing will not happen. Example, superior laryngeal nerve has to do adduction and tensor. If there is palsy in this, adduction and tensor cannot happen. So what will happen? That is abduction and floppiness of the vocal cord, laxity of vocal cord, or loss of tone due to cricothyroid palsy.